Welcome to Sky Women. I'm your host, Dr. Carolyn Moyers, a wife, mom, and board-certified OBGYN. This is a place to educate, empower, and inspire. Join us each week as we share the power of women's stories. Real women, real stories, real inspiration. Put on your stretchy pants. Let's get going.
Welcome to another episode of Sky Women. I am so excited to share with you guys today my good friend from the internet, Dr. Brooke Stubbs. She is a wife, a mom, and board-certified internal medicine physician practicing lifestyle medicine. She has a master's in nutrition from Columbia University, and she has just launched her new practice, Rooted Femme, to educate and support women in their prime to optimize their wellness and become the masters of their health so they can show up fully in every area of their lives. Welcome, Dr. Stubbs.
Hi, so happy to be here with you.
Yes, I'm thrilled to have you. Okay, so I'm going to share with everyone that we actually became friends on Instagram. Yeah. And we have supported each other as we've launched different businesses. And you were so kind to just pick up the phone and say, call me anytime after I reached out to you via Instagram. And you were the first one to send me flowers whenever I opened my practice. So I so appreciate that. Women supporting women.
Yes. And I'm so proud of you. And I think I've reaped more benefits from this friendship than I think you did, even though, I was the first to take the call. I'm so happy for our friendship.
Oh, thank you so much. Well, let's get started. Today, we are talking about really your story in medicine, but it really starts before that. I feel like you were sharing with me that in your teens, you were diagnosed with endometriosis.
That's right. Yeah. So I was 17 years old, which I had a very, I don't know at the time, she was just very progressive. She knew a lot about endometriosis, and she looked at me at 17 with really terrible periods that would debilitate me and keep me out of school. And I was a good student, so there's no reason for me not to be wanting to go to school. I was just like in the fetal position on my bed for a couple of days during my period. I'm like getting emotional thinking about it. But she said, I think you probably have endometriosis. And as a 17-year-old, hearing you could be at risk of not being able to have children, she really advocated for me to get on birth control in order to, I guess, in an essence, save my ovaries and really kind of get me to that phase in life. And I can't, without getting too emotional, I couldn't be more grateful for her and for, her insight into endometriosis, because it is so undiagnosed and because it is such a disease of, that gets pushed aside quite a bit. So that's how that started.
Yeah. So, we know endometriosis affects 1 in 10 women, girls, and transgender individuals around the world, right? And it's 7 to 10 years or 6 to 10 years, somewhere in there between symptoms and diagnosis. That's a long time of suffering.
A long time of suffering, and a long time that can be doing damage. We know that inflammation caused by endometriosis can, scar any of the organs that it affects, from yes, of course, the reproductive organs, but also it can seed into the colon or the bladder. And of course, it can also get into the ovaries, with each follicle that opens, and really can scar down the ovaries. And that is what, affects your fertility. So the longer it goes on unchecked, the worse ramifications. And like you said, the time from symptoms to diagnosis is just too long. It's just too long.
Well, I love that you was it an OB-GYN who advocated for you?
Yeah. And funny enough, and this is just kind of serendipitous, her last name was Sloan, Dr. Tracy Sloan. And my daughter, who I conceived through IVF, is Sloan. So,
I love that. That wasn't necessarily intentional.
No, it wasn't. But I remember I was thinking, I'm going to write a book about infertility. This is such a hard thing to go through. And when I was writing it and having my daughter, I realized that had happened. And I was like, that's just kind of a sweet little, magical
to her.
Yeah.
So tell us a little bit about your infertility journey.
So, it was really hard at 17, having that in the back of your mind. You go through so many life changes, and, you get into some relationships that are serious and some that aren't. And then you never know when to bring that up. You're like, I remember my now husband saying to me, okay, well, I'm just confused. How come you never have a period? And I was like, oh, you noticed, first of all, which was, I thought was, we didn't see each other very often because he was traveling for baseball. And I was like, well, okay. I think we'd been dating for like not even a year. And I was like, I guess it's time to have this conversation. Like, we're getting pretty serious. And so I was like, well, there's a possibility that I may have trouble with fertility. And he just took it in stride and, didn't skip a beat. And he, was very supportive, of course. So that was that. And then we ended up getting married, and, I was on birth control from like the age of 17 until I was ready to conceive. And I went to my OBGYN who, I had to switch because I moved to Texas at this point. And she didn't really know my history. I told her, but, she wasn't sure of my history. And so I was like, she was like, oh, just go try. Just get off birth control and go try. And I was just way too scared that A, wasn't going to work. I was going to waste a lot of time or make things worse, that I insisted. I was the biggest advocate for my own self. And I said, no, please, I need a referral to a fertility physician. I need to have, the laparoscopic surgery to rule it out, or to have this diagnosis and know what to do moving forward. And so the day I got into my now good friend, Natalie Crawford's office, she laid it out. She said, I was like after 2 weeks, I was having the surgery. I had it ablated, and, we talked about my options, and that it was the best case scenario for me then. At that time, I was 31, about to be 32, and I wanted multiple kids. And, we decided together that IVF was the best course of action for me, and went through that. And so I had a great experience with IVF. I was very, very fortunate. And I know for some people it doesn't go as easily. The shots were really hard, but I got 22 eggs. 14 of them came to the blastocyst stage, and then, 14 of them fertilized, 10 of them went to the blastocyst stage. Then we got genetic testing, and 6 of them were viable. And so we did a frozen transfer. I had to grow my endometrial lining like 3 times to make it. It wasn't even really thick enough, but at that point we were like, okay, I think this is as good as we're going to get. And so we did the first transfer and got my daughter. It was successful. It was like, when you go through all of that to get pregnant, it was very hard to be excited through that pregnancy.
Sure.
And then I bled. I had a really bad hemorrhage at 20 weeks. And so I remember my OB, who's a friend of mine, saying, okay, Brooke, I've talked to high risk emergency OB, and we can't even take her until she's 24 weeks. And so I just remember praying, like, just get to 24 weeks.
Yeah.
Just get to 24 weeks.
Sure.
So took a lot of joy out of pregnancy for me. But then did my second transfer with my son. She got to full term. She was born. She's beautiful. She's great. She's 3 years old now. And then we didn't choose with her. It was kind of a surprise with her. But then we chose to have a boy, which was, the next healthiest embryo on our list anyway. And it took, had a lot less issues in terms of scares with that pregnancy, but he's now 8 months old. So we had 2 successful transfers and still have 4 embryos. And I think we're done having children, but I love that process of IVF. I think it's such a miracle, and I love the miracle of science, and that it's a possibility to conceive that way, because I don't know if we would have had children otherwise.
It really is amazing, the advances that have happened in infertility in the last 20, 30 years. It's just really amazing.
Really, really, really cool. And even from my first to my second transfer, things were so different. I actually had to do a whole lot of shots with Sloan, my daughter, but then I did a modified natural cycle with my son, and it was a lot less traumatic, and it was really, really, really nice.
Oh, that's awesome. And so did you use Natalie Crawford for both of them?
I
Yeah.
did.
Okay.
I did. She switched practices, so I just followed her.
Right. Absolutely. Okay. Well, we can't record a podcast and not give a nod to Dr. Natalie Crawford, who is amazing. I think we know each other because of her.
Yes. Yes. Yeah. Yes.
Fantastic. Okay. Let's talk about the postpartum period, because you were in the thick of it.
Oh, God.
It's rough. It's rough.
It is. It's tough. So my first pregnancy had no issues really at all. I mean, very hormonal, and like, I think we had a really great couples therapist, which I'm not ashamed of at all. I think anybody who wants to have a really healthy relationship, having a third party is the best thing you can do for yourself. But she let my husband know that like during that period, when I have a baby, it's going to be the most vulnerable time of my life, and that I'm going to worry about that baby more than anything in the world. And so we had a lot of great communication and stuff. And so I was hormonal, but he just accepted it. And so I had good support, and I was blissful because I had my baby girl. And I kind of expected that with my second that I would be okay. And then I wouldn't have a whole lot of postpartum issues, which unfortunately was not the case. I had a little bit of anxiety. I was in a pandemic, obviously pregnant. I had quit my job. So there's a lot of change. I don't know. I think all of that played a part. So, and then I was having SVT, which I hadn't had since probably college.
Define that for our listeners.
Oh, sorry. Supraventricular tachycardia. And it's a pretty benign condition, and it comes and goes paroxysmally. And I used to get it a lot when I was dehydrated. Like I was a cheerleader in high school, and I'd get it while I was cheerleading and stuff like that. And I had gotten it one time when I was working out really hard before our wedding, but really infrequently. And then when I got pregnant the second time, I was getting it a lot, and it wasn't breaking. I could usually just like hold my breath or Valsalva and it would go away. But I was taking like 80 milligrams of propranolol with beta blocker, and it still wasn't going away. And I was like dunking my head in ice water and the whole 9 yards for like an hour. My heart rate was near the 200. So I was pregnant. And so it was frightening, right?
Sure.
And, I'm talking to my doctor and I'm texting with my cardiologist, and they're like, it's going to be okay. Like, it's not going to hurt the baby, but your heart rate's at 200 beats per minute.
You feel like you're in a panic. Yeah.
Yeah. So that was probably a lot of stress that, led to more stress. And then, you never know. I don't know how to handle a newborn in a pandemic. And so, whether or not to have people come and visit, and whether or not, you don't want to offend anybody, but then your one focus is to protect this new life. And so that was really stressful. And then I started having panic attacks, really bad panic attacks. I would be up at like 2 a.m. and I would my mom helped me for the first 3 weeks with my baby, and I'd had to go wake her up. I'm like, Mom, I need you to just sit with me because I can't do this. I don't know what's going on, but I feel like I can't breathe. Something terrible is going to happen. And I couldn't mentally, I always thought I was very strong, and, it was hormonal. I could not mentally like slow my mind down. It was too much for me to handle. And luckily a few weeks, I think 3, 4, maybe 5 weeks after my son was born, they went away, and I got help from a psychiatrist, which if anybody's in a place where they have to, if they're struggling with depression or anxiety or any kind of postpartum mental issues, I really am such a huge advocate for getting professional help, because I needed something. I needed a medication to be able to just stop those panic attacks when they started. And of course, I'm not on any medicine now, but it really was like a true lifesaver. I don't, when you are so mentally strong, one of your biggest fears is that you won't be able to control your thoughts or your mental status. And it was frightening. It was actually just incredibly frightening.
Yeah. Well, I love that you bring that up because we really need to normalize this conversation, right? And May is a mental health month. And so bringing awareness to that is really key. Like we have to recognize that and understand that it's okay to get help.
Yeah, absolutely. And because we don't talk about it enough and it's not normalized, I feel like people suffer in silence and it makes the problem so much worse. So anything I can do to advocate for it, to, put it out there so that it makes it less stigmatized for somebody to go get the help that they just really need.
Yeah.
I'm all about that.
Yeah. Well, so let's talk about your postpartum adventure you just went through. You decided to get some augmentation done.
Oh, yeah. So I breastfed both of my babies, my first longer than my second, but we all have a little bit of vanity and you want to look your best. And so I decided that I knew for a while, I knew after my first child that I wanted to get a breast lift because, breastfeeding just did, wreak havoc on the girls. And so I found a wonderful surgeon here in Austin, Dr. Ashley Gordon. I'll give her all the props because she is so good. And if you're looking for a surgeon, it was like all of the surgeons I kind of was considering, I would follow their before and after pictures. And Ashley's were the best. I was just like, like, okay, I want that. Like she can do it. Like, that's what I want to look like. And she did a great job. So I got a lift and like a little augmentation just to put back what I had lost.
Some volume that you lost.
I did. I lost quite a bit of volume. I did. They were, more like pancakes than anything prior. So
isn't that something? I mean, you're pregnant and like immediately your breasts increase in size. They're nice and perky. After you fed these babies, we're like, we're so tired.
They're all gone. Yeah. I mean, I went from like a cute perky B cup to like a double D to like I don't even know what you called what I had afterwards. I'm like, those aren't even.
Did it fit into your B bra?
They would honestly though, this is the sad part. I would put, I'd put on my bra and like if I bent over, it would fall out of my bra because it was just skin.
Or fit, yeah.
Oh my God. So, I mean, that was like when it fell out of my bra, there was like, I have no other option other than a plastic surgeon. So I did that and it's been great. I'm like 10 days out. I feel great and they look great and I'm so happy.
Awesome. Well, thank you for normalizing that as well. Keeping it real.
It is what it is.
Okay, so let's talk about your transition in medicine because you were a hospitalist as an internal medicine physician and you decided I'm going to shift focus. I'm going to quit my job and figure this out. You have always been a little bit of an entrepreneur though, because you were in business. Tell us about it.
Yeah. So, okay. So, well, you want me to start with that business or with the hospitalist thing? Well, I did. I opened a franchise of a good friend of mine's infrared sauna studio, which I love and I researched and I truly, truly believe in. And it's fabulous and people love it. It's very spa-like, it's very relaxing. And there was research behind the benefits of it and the science behind it is really, really quite fascinating. So I had already started that business, which when you do something like that and you really put yourself out there to like, I am of medicine mind, I am not a business person, but I'm going to open a business myself. You have to figure things out as you go, right? So then you're like one foot in front of the other. And with each step, you just figure out like what the next step is. And you make a few mistakes, but like you just
have to get in motion.
Yeah, you just have to keep going forward. I mean, it's just, that's how it is. You just got to keep making the next step. And so that, even though that was like just like my first gig of entrepreneurialism, it gave me a lot of confidence moving forward. Like I could do something on my own someday. Like I had the backup of the franchise for that, so I had the franchisor, my friend who I could lean on to ask questions. It really thrusted me into like, I can do this kind of confidence feeling. And so I was working as a full-time hospitalist and I was assigned to the bone marrow transplant service, which was a huge honor. and really, really had wonderful partners and colleagues. And the more work, the more busy, the harder the patients got, the more they really supported me. And I was getting burnout and they knew it. I would communicate that, like, these things aren't working for me. I had my daughter through that period, and, I had some issues with my pregnancy because of how stressful work was, and they accommodated that. And then, when I was getting burnout with work, they, took away some of my calls, and then they partnered me with a great nurse practitioner that I love. And she did all of my notes that I signed off on. And so that took away a lot of busy work, so I could focus on patients or get home in time, or, not have just it was mentally, physically, emotionally taxing. And I would get home every day of those, we worked 7 days on, 7 days off. Every day I'd be a zombie. I was irritable. I wasn't practicing medicine the way I wanted to practice medicine. We were so busy. I was so burnt out. I wasn't my happy-go-lucky self, which I was sometimes, but I couldn't be all the time because it was just so hard. It's just such hard work.
So these are 12-hour shifts, 7 days a week, or?
It depends. Sometimes longer. Yeah. It just depends until the work's done. That's when you go home. And, on average, we'd have about 21 very sick patients on our service. But when I first started, before I was just assigned the bone marrow transplant service, our group was handling the whole hospital, and we'd have sometimes 38 patients to see in a day. And some of them are sick in ICU. It was insane, just the amount of work there was to do. So high burnout rate. And then being on the bone marrow transplant service was very traumatic. And I'm very much empath, and I feel that very deeply whenever I lose a patient or if they're not doing well. And so before I decided, my husband was like, "Are you happy? You don't have to do this job. You can quit or whatever." And I didn't want to quit. I loved it. I was learning all the time, and it was exciting. And, when you're literally saving lives, and that purpose, you don't want to leave. And so we had a really bad week. We lost 4 patients in a span of 7 days. And, you leave those 7 days, you hope to recover, and you come back, and we're all kind of looking at each other like, is anybody else just feel like they've been hit by a dump truck? Yeah. It was really, really hard. And then I just remember praying, God, if this is the job that I'm supposed to be doing, if this is the work I really need to be, focused on, please remind me why I love it. And we just had another really bad week. We probably lost another couple patients that week. And I was like, okay, all right, I'm going to walk away. And it was really sad because I loved all the staff, and I loved all my partners and all my colleagues and all my patients. But I was pregnant, and serendipitously, I avoided a pandemic, with a pregnancy. I left in February before COVID really wreaked havoc in the hospital system in the US. And so, yeah, I left. And then it wasn't right away that I started Rooted Femme, but Rooted Femme it was in the brain. It was turning.
Yeah. So this is something that's been growing because you see this role as women in the family and communities. So talk to us a little bit about that.
Yeah. So the whole idea was, Natalie actually was the first person I talked to about quitting, because she had quit her job, and she's a big advocate for, doing what's good for you and moving on when it's time to move on. And so when I was talking to her about it, I said, what I really want is to be able to create a kind of annual for women, because there's such a gap in the healthcare system when you leave your pediatrician when you're well till and of course you see your reproductive doctors and you get your pap smears or whatever, but they can't do everything, and they're busy, and you see them for 15 minutes once a year. We're not being screened. We don't know what to do to keep up with our health. The gap is between being well in the pediatrician and then falling ill and ending up back in the healthcare system because you have a chronic disease. And so I remembered when I was 30, stressed out in medical school or in residency, and going to a supervisor physician who I really trusted and saying like, I'm here just because I want to know how to be healthy. And she's like, well, you look healthy. Like, I don't have anything to do for you. And I really like realized at that moment, I'm like, that's it. There's no doctor who knows how to keep us well. And in medical school, we learn a lot of these chronic diseases, the first line of therapy is lifestyle intervention, right? So we just never learned how to teach patients to take those lifestyle interventions and to put them into practice. And so then I was introduced to lifestyle medicine. And then, just through reading, and you learn about like these blue zones of the world where they have like the longest lifespan and they're the healthiest population, and you learn what they do and their activities and their nutrition and their diet and their relationships. And the science behind lifestyle medicine is so legitimate about, these are actionable things that we can do in the prime years of our lives in order to maintain our health so that we can live longer and that we can have energy and we can, really just take advantage and live a full life that's healthy and reduce the risk of chronic disease, right? And so when I decided at first that women needed this in their lives, Rooted Femme was going to be an annual conference or a retreat for a weekend where you come, you get all the tools, we have great speakers, maybe we draw labs, we talk about your lab, what it means for you, if you need to be seen a physician. And then COVID hit. And so we're like, okay, well, conference retreat isn't really going to work. So then I took Rooted Femme as my baby and I made it into a telehealth private concierge practice. Was membership based, and I see women and they pay just a monthly fee and they have total access to me. Most of my patients I see twice a month, so every couple of weeks. And we talk about everything from like their stress level to their nutrition to what their cholesterol looks like to what their chronic diseases are. And we hit on all of those things. And it's just a new way of practicing medicine because I really think more people should have a doctor that can spend the time with them. I spend up to an hour with my patients, which is just unheard of. It makes it impossible for me to take insurance though, of course. So
Sure.
It's a cash-based practice, but it's really the way I always wanted to practice medicine. And I love it.
I love that. Yeah. I love being able to give the time and space that patients really need to feel heard and to have their issues addressed where they feel like they're more than a diagnosis.
Oh yeah, for sure.
Yeah.
Because then you end up just throwing medicine at them and one medicine leads to another medicine and then all of a sudden
another complication and
Right.
Yeah.
Yeah.
Absolutely.
And we've never addressed the root cause.
Right. Well, I think that your nutrition background certainly helps with that.
For sure. Absolutely. And, it's always been a huge interest in my nutrition. And the more I read, the more interested I am. But, it comes down to the very basic that, the more plants that you have in your diet and the more whole foods that you have, like whole grains and legumes and beans and nuts and, just plant foods will increase your health. And not to say that we need everybody to be 100% vegan. I personally try. I still have my vices, but I think that everybody could do a little bit better. Unfortunately, just how we've been taught to eat, is that we need meat to be the main portion of our meals. And it's just not true. It's just, it's an unfortunate lie we've all been told for so long. And
I feel like this is an area that we could talk on for hours because patients want to do better. They really do want to do better. And they sincerely don't know how to eat better for their bodies.
Well, here's the sad part is they think that they are doing, like people who really focus on health and are health centric, they think that they're doing the best for their health when in reality, what they've been taught and what they know to be healthy may not necessarily be the healthiest options for them. And then we end up with all this very high saturated fat in our diet, leading to cholesterol and atherosclerotic disease and we know cardiac death is the highest cause of death in the United States, both men and women. So,
Yeah.
I mean, unfortunately, I see a lot of patients who have high cholesterol and they're like young people.
Yes. I've seen that as well.
It's sad.
Well, I love this movement that you're really creating. I love it. So currently you're doing telehealth. Tell everybody how they can find you.
You can find me on Instagram. Let's start there at Brooke Stubbs MD, BROOKIE Stubbs MD. And then I also have a website, brookstubbsmd.com. But if you want to set up an appointment with me, go to rootedfemme.com. It's ROOTEDFEMME.com and click on set up an appointment. And then you could just request an appointment there. And once I confirm it, I'll send over some patient intake forms and stuff like that. But yeah, that's how you can find me.
Awesome. Fantastic. Well, thank you for sharing with us today. I think it's always fun to really get to know your healthcare provider and understand that as a woman, like we're going through the thick of it as well, right?
Yeah.
And then really understanding how we can optimize our health. I think this is really awesome for so many women, because so many of us, me included, have seen my OB solely for the last 10 to 15 years, have not seen a primary care provider. So it's really important that we really look at that preventative piece of medicine, especially as we all age.
Yeah. And we want to age
gracefully,
slowly,
yes,
and gracefully.
Absolutely. Yeah. Absolutely. I'm with you.
Well, thank you for having me.
Absolutely. And thank you for always
talk with you forever.
Same.
I was done already.
Thank you for always being a supporter. Like, it's amazing. I just really appreciate your friendship.
Yeah. Same to you.
All right, Sky community, thank you for listening to another episode. This episode was sponsored by Sky Women's Health. As a reminder, we're in the Dallas-Fort Worth area, and we help relieve back pain and pelvic pain in pregnancy and beyond. If you are pregnant and having pain and you feel like you have no reliable way to relieve it, look us up at skywomenshealth.com, request an appointment, and we'll call to get you scheduled. As a board-certified OB-GYN with a Neuromusculoskeletal Medicine fellowship, I help you realign with hands-on drug-free treatment and relieve pain on the spot without medication. We'll help you maintain these results through your pregnancy and postpartum period. Every pregnant person deserves this, and we are so excited to serve you. You can find us on our website, as mentioned, or on social at Sky Women's Health, or you can call the office at 817-915-9803. That's it for today. Until next week, be well.